Welcome to Med Madness, your go-to podcast for unraveling the complexities of medicine. Today, we're diving into an essential topic, the various types of abortion. Understanding these distinctions is critical for both healthcare providers and patients. So let's explore the 5 main types: missed abortion, threatened abortion, inevitable abortion, incomplete abortion, and complete abortion. First, let's talk about missed abortion. This occurs when an intrauterine pregnancy ceases before 20 weeks of gestation, but the products of conception aren't immediately expelled. Women experiencing a missed abortion often have no vaginal bleeding and a closed cervical OS. They may notice a reduction in pregnancy symptoms such as nausea or breast tenderness. Advanced maternal age is a significant risk factor here, as it increases the likelihood of fetal chromosomal abnormalities. On ultrasound, you might see an embryo without cardiac activity or an empty gestational sac without a fetal pole. To confirm viability, serial ultrasounds and BHCG levels are essential. In viable pregnancies, BHCG levels rise during the first trimester, accompanied by continued embryonic development. Conversely, non-viable pregnancies show decreasing BHCG levels and halted embryonic development. Moving on to threatened abortion, this condition presents with vaginal bleeding while maintaining a closed cervical OS and fetal cardiac activity. This can be a distressing situation, but the presence of a heartbeat is reassuring. Management typically involves careful monitoring with ultrasounds and BHCG levels to ensure the pregnancy's progression. Next, we have inevitable abortion. This type manifests with vaginal bleeding, lower abdominal pain, and a dilated cervical OS, indicating the products of conception are likely to be expelled soon. Ultrasound findings often reveal a non-viable gestation in the lower uterine segment. Treatment options vary from expectant management, where we allow the process to occur naturally, to medical management with prostaglandins, or surgical intervention like suction curettage, depending on the patient's preference and stability. Incomplete abortion involves vaginal bleeding and a dilated cervical OS. But here, some products of conception are expelled, while some remain inside the uterus. This situation requires medical intervention to remove the remaining tissue to prevent complications such as infection or excessive bleeding. Finally, complete abortion occurs when all the products of conception are expelled, leading to vaginal bleeding and a closed cervical OS. Patients might experience lower abdominal pain and heavy bleeding, which subsides after the expulsion. Ultrasound will show an empty uterus, though you may also find a small ovarian cyst representing the corpus luteum and fluid in the pelvis from retrograde bleeding. To bring these concepts to life, let's discuss a real-life case study. A 32-year-old woman, who we'll call Sarah, presented to the clinic at 12 weeks of gestation with concerns about decreased pregnancy symptoms. Initially, Sarah had typical symptoms such as nausea and breast tenderness, which had significantly diminished over the past week. She had no vaginal bleeding or abdominal pain. On physical examination, her cervix was closed. An ultrasound revealed an embryo without cardiac activity, confirming a missed abortion. Sarah's BHCG levels were found to be decreasing, reinforcing the diagnosis of pregnancy demise. Given her emotional and physical well-being, Sarah opted for surgical management, and suction curettage was performed without complications. This approach helped her to quickly and safely resolve the condition, allowing her to focus on emotional healing and planning for the future. In conclusion, understanding the different types of abortion and their clinical presentations is vital for providing appropriate care. By recognizing the nuances of each type, healthcare providers can better support their patients through these challenging experiences. Thank you for tuning in to Med Madness. Remember, knowledge is the key to compassionate and effective healthcare. Stay curious, stay informed, and join us next time as we delve into more medical mysteries. If you have any questions or comments, we'd love to hear from you. Until then, take care. That wraps up today's episode on the types of abortion. If you found this episode helpful, please share it with your colleagues and friends. Don't forget to subscribe to Med Madness for more insightful discussions. Have a great day, everyone.